2-year-old asthmatic severe Pactus ectovatum baby. Nurse procedure is not available for him. How to treat his deformity? A 2-year-old boy was diagnosed with Pactus ectovatum. After birth, the anterior chest wall was found to be sunken, and the depth fluctuated with breathing, and there was abnormal breathing. Shortly after birth, he developed pneumonia and was in critical condition, and the inflammation disappeared after resuscitation. But he had suffered from cold and pneumonia many times since then. Each episode was severe, often hypoxic, requiring oxygen to sustain life. The overall nutritional status of him was poor, and development was lower than that of children of the same age. He went to several hospitals but refused to operate on him because of young age. With the increase of age, the child's condition gradually worsened, and he was recently admitted to our hospital for surgery. After admission, physical examination showed that the anterior chest wall was deeply depressed. The right edge of depression was raised, the left and right chest walls were asymmetrical, and the heartbeat could be seen on the chest wall. Imaging studies showed a depression in the anterior chest wall, with the right edge of depression being higher than the left edge. The bottom of depression compressed the heart, and the heart shifting to the left chest cavity. The child had a clear diagnosis of asthmatic severe Pactus ectovatum with an indication for surgery. After thorough preoperative preparation, we performed surgery on the child. One procedure was adapted. The surgery is performed under general anesthesia. In supine position, an incision was made in front of the xiphoid process, and the incision is 1 cm long. The subcutaneous tissue was separated, revealing bone structures in the depression, and the retrosternal space was exposed. Tunnels was made on both sides of the surface of the bone structure, and the tunnels was located in the deep surface of the soft tissues. 3 steel wires were placed across the bone structures of depression. A special steel bar was inserted into the tunnel, and the steel wires lifted the bone structures of depression and fixed them to the steel bar. Finally, the depression was eliminated. The incision was closed, and surgery was over. The total operation time was 25 minutes, and the operation was smooth, and there was no complications. The appearance of the chest wall was completely normal after surgery. There are 2 main classic features in the child. First, young age, and second, special malformations. These 2 features play a decisive role in the choice of a surgical modality. The most popular type of surgery for Pactus ectovatum is nurse procedure, but it cannot be used for many types of Pactus ectovatum. First of all, because the chest wall structures have special requirements, and the chest wall structures of young children cannot meet this requirement. It is generally considered that children under 3 years old should not use this procedure. Secondly, since the basic principle of this surgery is to prop up the depressed chest wall, if there is other deformities other than depression, the results will not be satisfactory. This child is younger than 3 years of age and is unable to use nurse procedure, and even if it is chosen due to the bulge of the right edge of the depression, when the depression is propped up, the right edge of the bulge will become taller without special treatment, which is obviously an unacceptable result. Because of this, the nurse procedure cannot be used in the surgery of this child. At present, the only option for the vast majority of doctors to treat Pactus ectovatum is nurse procedure, which is the root cause of this patient's lack of treatment in many hospitals. The method we use is Wang procedure. The principle of this procedure is completely different from that of nurse procedure. During the operation, a curved steel bar is placed on the outer surface of the depression, and the depression is lifted by the steel wires and fixed to the steel bar, which can complete the correction of the depression. This surgery has an opposite requirement for the structures of the chest wall than nurse procedure. The softer the chest wall, the better the outcome of the surgery. Young children have soft bones, so they are more suitable for Wang procedure. In particular, the Wang procedure will compress the edge of the depression while lifting the depression. If the edge are raised, the bulges can be flattened at the same time. Therefore, this surgery has a dual effect. We refer to this action as tablet shaping. This is the ideal way to get in shape. The deformity of the child can meet the basic requirements of the Wang procedure, so it is good fit for this procedure. It is safe to say that Wang procedure was the only reasonable option for this child. We used this procedure and got the result we wanted. In addition to the above features, Wang procedure has many advantages over nurse procedure, the most important of which is security. Since all the manipulations are on all the surface of the bone structure, there is no damage to the heart, making this procedure the safest option for pectus ectopitum surgery. I'm Dr. Wang from China.